Hello, everybody. Welcome to the Natural Food Pantry Education Series. I'm here today with my guest speaker, Dr. Kate Rheaume, Naturopathic Doctor, who will be speaking on cholesterol and heart health. Dr. Kate Rheaume is a graduate and former faculty member of the Canadian College of Naturopathic Medicine. As a very reputable educator, Dr. Kate speaks internationally on many topics related to health and wellness. She is the author of the best-selling book, Vitamin K2 and the Calcium Paradox, How a Little Known Vitamin Could Save Your Life. We are so fortunate to have Dr. Kate with us as a regular presenter at our Natural Food Pantry Education Series. Welcome back, Dr. Kate. It's always a pleasure to have you with us.
Thanks, Natasha. Great to be back.
So, cholesterol and heart health. I think a lot of people really push the panic button when their blood results come back showing high cholesterol, high LDL levels. And I know you have a bit of a different take on the topic. So I'd love to know, is having high cholesterol really should it be that much of a concern for individuals? What are your thoughts on this?
This is a really important point, and you're right. I know and have met and meet a lot of people who have been told, well, my cholesterol is a little bit high, and my doctor said I should take a medication for it, but I'm not sure. And our focus around heart health and heart disease, in the last 20 years has been almost exclusively about cholesterol. Get it checked. If it's high, take a medication to lower it. If it's not high, then maybe you're fine, is the sort of thinking. And, when it comes to heart disease, there's some good news and bad news. The good news is that less people are dying of heart attacks than ever before, which is great news. However, that seems to be because we are better at saving people who have signs of a heart attack. Emergency and life-saving measures are much better now. Your chances of surviving a heart attack are much better now than they ever have been or have been for the last 10, 20 years. So that's good news, but the bad news is more people are having heart attacks. So that suggests that, in fact, we are failing in preventing heart attacks. And so even though more people than ever are also taking cholesterol-lowering medications, there's also more people having heart attacks. And it turns out that cholesterol, we used to think that cholesterol, or we talk about cholesterol as if it caused heart attacks. You have high cholesterol and it would kind of clog your arteries like a clogged pipe. And then that would cause a heart attack. And that's definitely not how it happens. And in fact, not only does cholesterol not cause heart attacks, but having high cholesterol levels is not a really good predictor of your risk of having a heart attack. In other words, if you have high cholesterol, it doesn't really predict or increase your risk of having a heart attack down the road. The correlation between high cholesterol and heart attacks is not that strong. It's especially not strong for women. It's especially not strong for women and men over the age of 70 at least, probably more like 60. In other words, as you get older, in fact, and this is really surprising news to people, a little bit of high cholesterol has been associated with a lower risk of both heart attacks and dementia.
Oh, wow.
So certainly for anybody who has, I'm not here to go against anybody's doctor's orders, for example, but definitely if you look at the research, the statistics, a little bit of high cholesterol is absolutely not associated with an increased risk of a heart attack and may in fact be protective.
Wow. So that's a little controversial. When should people be concerned about high cholesterol? Should people be concerned at all?
And so that becomes the question, right? So what's our new, benchmark? When do we become concerned about cholesterol? Do we become concerned about cholesterol? And I do hate to say things that is confusing to people, especially if they think they've got that all sorted out. But at the same time, I really do think just focusing on cholesterol has led us astray in the fight against heart disease. And the fact that more and more people are taking cholesterol lowering medications, the threshold, in other words, how high your cholesterol has to be prescribed one of those medications has come down over the years. So more people are taking them and more people are having a heart attack. So I don't think we can say this has been successful, and certainly the numbers bear it out. So to your question, when is cholesterol a concern, or is it cholesterol concern? It's not that we can completely ignore it all the time for everybody. As part of a bigger picture, if somebody has lots of other risk factors, the person is overweight, they maybe also have diabetes, maybe they're also a smoker, they don't exercise, they have a strong family history, and they have high cholesterol. So then as part of this picture, okay, again, the solution may not be to immediately take a cholesterol lowering medication. Certainly if the person has a personal history, they've already had a heart attack, that's another time to take into consideration high cholesterol. So just high cholesterol on its own in an otherwise healthy person, regardless of your age, I don't really think is particularly important at all. If cholesterol is extremely high, and that may sort of clue you into wanting to be looked at, well, there are other things going on. Should you check, for example, for markers of inflammation? Because that ultimately is a big risk factor. Absolutely, you also want to be checking blood pressure. If somebody has high cholesterol and high blood pressure is really serious, always needs to be taken seriously, always needs to be managed. You always need to take your medication. That is a really important risk factor that can't be ignored. And so that's more important to look at for sure. So cholesterol on its own, in otherwise healthy people, rarely is something that I pay that close attention to. But as part of this bigger picture, then you want to, consider that.
Right, right. And I do know from people who come into the store, when people do have high cholesterol levels, they're often attempting to lower their cholesterol through diet and supplementation. And I know many of the studies out there showing that dietary changes aren't all that effective for lowering cholesterol. What's your take on that?
It's true. The studies are fairly consistent on that. But unfortunately, that's because most of the studies that have looked at the effects of diet and nutrition on cholesterol have looked at low fat diets. And once you lower your fat intake, you typically increase your carbohydrate intake.
Yes.
That often leads to higher insulin levels, often to weight gain. And ultimately, yes, will have no benefits on cholesterol levels. So again, people have lowered their cholesterol or trying to lower their cholesterol by cutting fat out of their diet. And that has been across the board shown to be quite ineffective because, in fact, lowering carbohydrate intake is probably a more effective way of dealing with cholesterol in terms of nutrition.
Yes, yes, absolutely. So with so much information out there on cardiovascular health, there's information coming at us in every direction, and it can be very confusing. What is your number one main take-home message for people around cardiovascular health?
That there absolutely are things that we can do to protect our heart health if you're concerned about it for any reason. And lowering cholesterol is, depending on your situation, probably the least important thing that we can do. Checking inflammation and keeping that down is more important. Checking blood pressure and keeping that down is extremely important. And there are other nutrients, for example, we talk about cardiovascular health. That's a huge umbrella term that encompasses lots of conditions. But really what we're thinking about, what kills people is heart attacks, of course, typically heart attacks and strokes. And that is often caused by atherosclerosis, which is hardening of the arteries, which is this, when we say hardening, they literally do become hard, typically because of the deposition of calcium in the arteries. And so how do we prevent that from happening? And there are many nutrients that can both lower inflammation and or prevent this hardening of the arteries. And so that's what we're going to talk about in the upcoming webinar.
I was just going to go to that. So November 8th, you're offering a webinar on healthy hearts. It's called Healthy Hearts, Myths and Facts About Cholesterol. And it's going to be offered through Natural Food Pantry. So you'll be sharing information about supplements that can be used. What else will people be learning from the webinar?
We'll talk about heart health from a more functional perspective. This includes a discussion of the endothelium. While this sounds technical, in fact, this is the lining of all of our blood vessels. And when the blood vessels may become hardened, for example, or there's buildups and issues there, that has to do with the lining of the blood vessel. That, in fact, it's its job to prevent that. There may be something going wrong there. How can we support that? That's a far more functional way to approach heart health. And so hopefully it will be, news you can use, news that people can use to really make a meaningful difference in their heart health.
Oh, no doubt it'll be helpful for many, many people. Thank you so much for sharing your time and your knowledge with us. I love having you here on board with the Natural Food Pantry Education Initiative. For those who would like to register or gain more information on the upcoming webinar on November 8th, please visit our website at naturalfoodpantry.ca. Be sure to follow us on Facebook, Instagram, and YouTube, and subscribe to our newsletter through our website as well. Thank you, everybody. Stay healthy. Bye-bye.